Hello everyone, welcome back to Healthy Care. Have you ever wondered if your brain is getting the nutrients it desperately needs to stay sharp and focused? What if the key to preventing memory loss and cognitive decline is already within your reach, but you're not aware of it? Dementia is a growing global concern, affecting millions of lives and families every year. Yet many people overlook one of the most powerful tools for brain health: proper nutrition. In today's video, we're diving deep into the hidden power of 12 miracle vitamins and supplements that can transform your brain health and help prevent dementia. From boosting memory to reducing brain inflammation, these nutrients could be the game changers you've been looking for. And trust me, you won't want to miss vitamin 11. It's practically a miracle for your brain, and few people know about its incredible benefits. So if you're ready to take charge of your cognitive health and learn how small dietary changes can make a huge impact, stay tuned. Your brain deserves the best, and it all starts here. 12 Resveratrol. Resveratrol is a powerful polyphenolic compound found in the skin of red grapes, blackberries, and blueberries. It is widely recognized for its antioxidant and anti-inflammatory properties, which benefit both cardiovascular and brain health. One of resveratrol's primary mechanisms is the activation of a protein called SIRT1, which plays a crucial role in regulating cellular aging and protecting against oxidative stress. This activation helps protect neurons from damage, promote their survival, and support overall brain health. Resveratrol has also been shown to improve cerebral blood flow, ensuring that oxygen and nutrients reach brain cells for optimal functioning. Studies suggest that it may help preserve memory and cognitive function in older adults while delaying the onset of cognitive decline. Additionally, resveratrol shows promise in reducing the accumulation of beta-amyloid plaques in the brain, a hallmark of Alzheimer's disease. While resveratrol can be consumed naturally through foods like grapes and red wine, achieving the levels necessary for its neuroprotective benefits may require supplementation. Resveratrol supplements are available in various forms and dosages, but it's vital to consult a healthcare professional before starting them, particularly for individuals with underlying health conditions or taking medications. 11. Curcumin. Curcumin, the main active compound in turmeric, is celebrated for its potent anti-inflammatory and antioxidant properties. Chronic inflammation in the brain is one of the key factors in the development of neurodegenerative diseases like Alzheimer's. Curcumin helps combat this inflammation, protecting brain cells from damage and promoting overall cognitive health. In addition to its anti-inflammatory effects, curcumin fights oxidative stress by neutralizing free radicals and boosting the production of antioxidant enzymes in the brain. These properties prevent neuronal cell death and help preserve cognitive function as we age. One of curcumin's most significant advantages is its ability to cross the blood-brain barrier. This allows it to directly target and protect brain cells from processes that accelerate aging and cognitive decline. Moreover, curcumin has been studied for its ability to reduce the buildup of beta-amyloid plaques, which are characteristic of Alzheimer's disease. These plaques interfere with neuron communication and are a primary cause of memory loss and cognitive dysfunction. To maximize the benefits of curcumin, it is recommended to consume it with piperine, a compound found in black pepper that enhances curcumin absorption by the body. Curcumin supplements are also available and are often formulated with piperine for better bioavailability. However, consulting a healthcare professional before supplementation is essential, particularly for those with pre-existing health conditions or taking medications. 10. Omega-3. Omega-3 fatty acids, especially D-docosahexaenoic acid, are essential components of brain cell membranes and play a crucial role in the development and maintenance of brain function throughout life. They are known for their anti-inflammatory properties and for promoting the health of synapses, which are the connections between neurons. Studies show that omega-3 deficiency is associated with an increased risk of cognitive decline and the development of neurodegenerative diseases, including dementia. DHA is particularly important for cognitive function as it constitutes a large part of brain tissue and is essential for the growth and repair of nerve cells. Additionally, EPA-eicosapentaenoic acid, another type of omega-3, contributes to the reduction of inflammation in the brain, a key factor in protecting against neuronal degeneration. Chronic inflammation in the brain can lead to cell death and the accumulation of beta-amyloid plaques, which are characteristics of Alzheimer's disease. Supplementation with omega-3 has shown significant benefits in preserving memory, improving concentration, and reducing the risk of dementia. Dietary sources rich in omega-3 include fatty fish like salmon, sardines, and tuna, as well as algae, which are an excellent alternative for vegetarians and vegans. For those who do not regularly consume these sources, fish oil or algae supplements can be an effective way to ensure adequate omega-3 intake. Regular inclusion of omega-3 in the diet can have a protective effect against dementia, maintaining the integrity of brain cells and slowing cognitive decline. Additionally, these fatty acids also contribute to cardiovascular health, which is directly linked to brain health, as a healthy circulatory system is essential for delivering oxygen and nutrients to the brain. 9. Ginkgo biloba. Ginkgo biloba, derived from the leaves of the ginkgo tree, is one of the oldest and most studied herbs for brain health. Its antioxidant and anti-inflammatory properties are vital for protecting brain cells and promoting cognitive function. One of the primary benefits of ginkgo biloba is its ability to increase cerebral blood flow, ensuring proper delivery of oxygen and nutrients to the brain. Adequate blood circulation is essential for cognition, memory, and concentration. As we age, reduced blood flow to the brain can contribute to cognitive decline and increase the risk of dementia. Additionally, ginkgo biloba helps neutralize free radicals, reducing oxidative stress, a key factor in brain aging and neurodegeneration. Studies have shown that ginkgo supplementation improves memory, reaction time, and cognitive performance in older adults, particularly those showing early signs of cognitive decline. While generally safe, it's essential to consult a healthcare professional before using ginkgo, especially if you're taking blood-thinning medications, as it may increase the risk of bleeding. 8. Coenzyme Q10. Coenzyme Q10. CoQ10 is a vitamin-like substance found in every cell in the body, essential for energy production in mitochondria, the cell's powerhouses. In the brain, where energy demand is high, CoQ10 plays a crucial role in maintaining neuronal function and protecting against oxidative damage. As we age, CoQ10 levels naturally decrease, contributing to cognitive decline and an increased risk of neurodegenerative diseases like dementia. CoQ10 functions as an antioxidant, neutralizing free radicals that can damage brain cells and accelerate aging. It also helps stabilize cell membranes and protect brain cells from apoptosis-programmed cell death. Studies suggest CoQ10 supplementation can improve cognitive function, particularly in older adults or those with a deficiency. Dietary sources include red meat, fatty fish like salmon and mackerel, spinach, and broccoli. However, supplements are often necessary to achieve therapeutic levels. CoQ10 also supports cardiovascular health, which is closely linked to brain health, as adequate blood flow ensures oxygen and nutrients reach the brain. 7. Zinc. Zinc is an essential mineral with numerous roles in the body, including supporting immune function, DNA synthesis, and protein repair. In the brain, zinc is concentrated in synapses and contributes to synaptic plasticity, which is the brain's ability to adapt and reorganize neural connections. This plasticity is fundamental for learning, memory, and cognitive function. Zinc deficiency has been linked to neurological problems such as depression, anxiety, and cognitive decline. It also plays a key role in protecting the brain from oxidative stress and inflammation, both of which contribute to aging and the development of neurodegenerative diseases. Additionally, zinc is necessary for producing neurotrophic factors, proteins that promote the survival and growth of neurons. Foods rich in zinc include red meat, chicken, shellfish, nuts, and seeds. For those at risk of deficiency, zinc supplements can help maintain brain function and reduce the risk of dementia. However, zinc levels must be balanced with copper to avoid disrupting brain health. 6. Magnesium. Magnesium is an essential mineral that plays a key role in nerve function, protein synthesis, and blood sugar regulation. In terms of brain health, magnesium is crucial for proper transmission of nerve signals and the formation of synapses, connections between neurons that are critical for memory, learning, and overall cognitive function. Magnesium deficiency has been associated with various neurological problems, including anxiety, depression, migraines, and an increased risk of cognitive decline and dementia. Low magnesium levels in the brain can lead to the deterioration of synapses, contributing to memory loss and cognitive dysfunction. Additionally, magnesium helps protect the brain against oxidative stress and inflammation, both of which are linked to neurodegenerative diseases. Foods rich in magnesium include nuts, seeds, leafy greens, and whole grains. For individuals with difficulty maintaining adequate magnesium levels, supplements such as magnesium L-threonate, which effectively boosts magnesium levels in the brain, can be beneficial. Magnesium also contributes to better sleep quality, an essential factor for cognitive health and memory consolidation. 5. Vitamin C. Vitamin C is widely known for its antioxidant effects, which protect the body's cells from free radical damage. In the brain, these effects are especially critical as brain tissue is highly susceptible to oxidative stress, which can accelerate aging and contribute to neurodegenerative diseases like dementia. Beyond its antioxidant properties, vitamin C is essential for the synthesis of neurotransmitters, such as dopamine and serotonin, which regulate mood, memory, and cognitive function. Deficiency in vitamin C has been associated with an increased risk of cognitive decline and dementia. Vitamin C also protects the brain's blood vessels and helps maintain the integrity of the blood-brain barrier, which prevents harmful substances from entering brain tissue. Rich sources include citrus fruits like oranges and grapefruits, as well as strawberries, bell peppers, and broccoli. For those unable to get enough vitamin C through diet alone, supplementation can be an effective way to protect the brain from oxidative stress and cognitive decline. 4. Folic acid. Folic acid, also known as vitamin B9, is an essential nutrient crucial for DNA synthesis, repair, and the production of neurotransmitters, which are the brain's chemical messengers. A deficiency in folic acid has been linked to increased levels of homocysteine, an amino acid that, in high concentrations, is associated with a higher risk of cognitive decline and dementia. Folic acid helps keep homocysteine levels under control, protecting the brain from arterial and tissue damage caused by this amino acid. Studies indicate that folic acid supplementation can improve cognitive function in the elderly and reduce the risk of developing dementia, especially when combined with other B-complex vitamins like B6 and B12. Additionally, folic acid supports the formation and maintenance of brain cells, providing a protective effect against brain aging. Natural sources include leafy green vegetables, beans, peas, nuts, and citrus fruits. However, maintaining adequate levels may be challenging for the elderly or those with nutrient absorption issues. In such cases, supplementation can be an effective strategy to preserve mental health and prevent neurodegenerative diseases like dementia. 3. Vitamin E. Vitamin E is a potent antioxidant that plays a crucial role in protecting brain cells from oxidative stress, one of the main factors contributing to brain aging and neurodegenerative diseases. Oxidative stress occurs when free radicals damage cells and tissues, leading to cell death and loss of cognitive function. Studies have shown that vitamin E can protect against this damage by preserving cell membranes and supporting healthy brain function. It has been associated with a reduced risk of Alzheimer's disease and better memory in older adults. In addition to its antioxidant action, vitamin E helps regulate gene expression and cell signaling processes, which are fundamental to maintaining brain functions. Dietary sources like nuts, seeds, and vegetable oils or supplementation can help ensure adequate intake. However, it's important to balance consumption, as excessive doses may have adverse effects. 2. Vitamin D. Vitamin D, often called the sunshine vitamin, plays a vital role in maintaining bone and immune health. But its influence on brain function and mental health has received increasing attention. Studies have shown a strong correlation between low vitamin D levels and a higher risk of cognitive decline and dementia. Vitamin D helps regulate the growth and activity of nerve cells in the brain and protects against inflammation, which can damage neurons and lead to neurodegenerative diseases. Deficiency is common, especially among the elderly, who may have limited sun exposure and a reduced ability to synthesize vitamin D in their skin. Symptoms of vitamin D deficiency include memory loss, difficulty concentrating, and even depressive symptoms, which are often associated with the onset of dementia. Supplementing with vitamin D can be a simple and effective strategy to reduce these risks. Adequate levels improve brain function, maintain synapse health, and even reduce the formation of beta-amyloid plaques, a characteristic of Alzheimer's disease. 1. Vitamin B12. Vitamin B12 is essential for the health of the nervous system. It plays a crucial role in the formation of myelin, the protective layer of nerves, and the synthesis of neurotransmitters, the brain's chemical messengers. Vitamin B12 deficiency can lead to a range of neurological problems, including memory loss, confusion, and even dementia. In elderly individuals, this deficiency is particularly concerning because the absorption of vitamin B12 decreases with age. It's due to reduced stomach acid production, which is necessary for its absorption. Research suggests that low levels of vitamin B12 are associated with brain shrinkage and loss of brain volume, both risk factors for dementia. Prolonged deficiency can cause permanent damage to the brain and nerves, emphasizing the importance of maintaining adequate levels. Supplementation, especially in sublingual or injectable form, can be an effective measure to prevent these adverse effects. This is particularly true for at-risk populations such as the elderly and those with restrictive diets like vegans. Additionally, vitamin B12 works in conjunction with other B-complex vitamins, such as folic acid and vitamin B6, to control homocysteine levels in the blood. Elevated homocysteine is associated with an increased risk of dementia and cardiovascular diseases. Your brain is your most valuable asset, and protecting it starts with small, intentional steps. The 12 vitamins we've explored today are more than just nutrients, they're your allies in the fight against cognitive decline and dementia. Whether it's a simple dietary change or adding supplements to your routine, the path to a sharper, healthier mind is within reach. If this video inspired you to take action, make sure to like, subscribe, and share it with your loved ones. By subscribing to Healthy Care, you'll stay ahead with tips and insights designed to help you live your best, healthiest life. Don't wait, start investing in your brain health today.